Hi, my name is Alex Hess, and I'm a law and policy analyst at the Center for Public Health Law Research. I worked on our COVID-19 state emergency declarations and mitigation policies dataset, and today I'll be talking a little bit about that dataset and related questions on correctional facilities, as well as our policy surveillance methods. Next slide. So policy surveillance methods includes an understanding of legal epidemiology, which is the deployment and scientific study of law as a factor in the cause, distribution, and prevention of disease and injury in a population. Policy surveillance can be defined as the systematic collection, analysis, and dissemination of laws and policies across jurisdictions or institutions, and also over time. So here on the right, you see a diagram of our process of collecting and coding laws with quality control measures in place throughout the entire process. Next slide. And so for our COVID-19 data set, this process looked a little bit different in that we rapidly conducted policy surveillance. And so we wanted to make this data available as quickly as possible. And in order to do that, it entailed a number of things, such as an iterative scoping process. We met regularly to discuss the scope of our questions and variables to make sure that they were in line and accounting for different aspects of policy response that were cropping up over time across states during the COVID-19 response. We also had to research across various sources. So we weren't just looking to Westlaw. We were looking at state government websites, agency web pages. We were also looking to things like press releases, because sometimes that was the only place information might have been available at a certain point in time. We saw an unprecedented amount of change in the law in this short period of time. And so in order to make sure the data was available as quickly as possible, we had to modify our redundant research and redundant coding processes. But to maintain quality control measures within this process, we also used secondary sources to provide kind of an external check on the way we were researching and coding and capturing these variables. Next slide, please. Like I mentioned, our COVID-19 data set is a longitudinal data set that looks at COVID-related emergency declarations and mitigation policies from January through July 1st of 2020. We looked at a number of different variables such as school and business closures, social distancing requirements, face mask requirements, and limitations on medical procedures. We also looked at variables related to state level requirements regarding correctional facilities. This included the type of facility, as well as type of requirements such as suspension of intakes, of transfers, or of other procedural requirements, as well as inmate release requirements. We also kept track of case law imposing correctional facility requirements related to these policies. Next slide. And here are just a couple of maps. On the left-hand side is a map of all of the states that had some kind of executive order with requirements related to operation of correctional facilities in place as of July 1st, 2020. And on the right-hand side is out of those states, those 7 that had implemented some form of a inmate release requirement. And so now I'll turn it over to my colleague Sabrina to talk a little bit more about criminal justice and correction departments related to MOUD.
Hi, so as Alex mentioned, I'm Sabrina Ruchelli. I'm a law and policy analyst at the Center for Public Health Law Research. So I'll just be talking about our project with the Justice Community Opioid Innovation Network, or JCOIN, which also looks at COVID-19, but through the specific lens of the opioid epidemic, particularly as it relates to individuals involved with the criminal justice system. As a note, this is not a completed data set. This is something that we are still in relatively early stages on. So I'll just be providing a brief overview of the project, our specific correctional facilities database, and some anticipated challenges and solutions that we kind of expect to run into. So for the project overview, I think Alex already provided a lot of the relevant context, but suffice to say, the outbreak of COVID-19 has threatened to exacerbate the ongoing opioid epidemic in the United States, which already kills more than 130 people each day. And states have responded to COVID-19 with an unprecedented amount of legal action, some of which may significantly affect access to treatment for individuals living with opioid use disorder, including or even especially those involved in the criminal justice system. So this project seeks to create longitudinal data capturing those measures across all 50 states and Washington, D.C., enabling the evaluation of the impacts of these emerging laws and policies on health outcomes and access to treatment for opioid use disorder. So there's going to be 3 data sets as a part of this project. They are policy changes increasing access to buprenorphine and methadone, Medicaid waivers, and of most relevance to this conference, mitigation policies at correctional facilities. And we'll get more into the specifics of this data set in a moment, but I just want to briefly touch on the kind of 2 aims of this project, or I guess you could consider them as steps. So for aim 1, we'll be starting off by creating these 3 data sets cross-sectionally, that is capturing 1 point in time. And then for aim 2, we'll be moving to update them as time goes on in order to capture longitudinal data between 2020 and 2022 to see how things continue to change and develop over time as the COVID pandemic continues. So as Alex touched on pretty heavily, COVID-19 is a huge cause of concern among prison populations, not just because of the ease of community spread due to the close proximity among inmates, but also because people in correctional facilities tend to have higher rates of underlying health problems. And this is on top of the fact that those involved with the criminal justice system already face unique barriers to treatment and care for OUP. So the second data set, mitigation policies at correctional facilities, will really focus on laws, regulations, and executive orders aimed at mitigating the spread of COVID-19 in correctional facilities, as well as those aimed at facilitating OUD treatment for released populations. So just starting off, taking a look at our 4 preliminary legal variables. These might change and develop over time as we continue through this project, but to start off with, we're anticipating looking at expedited release of specific at-risk populations, restricted visitation policies, remote community supervision, that is reduction of in-person contact for the use of video and remote community supervision for things like probation and parole hearings, and continuation of OUD treatment. So taking policies aimed at ensuring the continuation of OUD treatment from within correctional facilities for released populations. Really what this data set is taking that sort of isolated question within our broad COVID-19 data set and really trying to expand it and dig in deeper into, how these policies are developing. So just a few anticipated challenges. The still rapidly evolving nature of tracking COVID-19 policies makes it vital to create a flexible but consistent coding scheme. And flexibility and consistency don't always go together that easily. Also, in keeping in line with that iterative scoping that Alex was mentioning earlier, we still need to be predictive regarding what variables we might see. And also, as Alex noted, this really requires a much more expansive research approach than in your average policy surveillance project. Some coding issues, again, kind of drawing on our experience with COVID-19, looking at things like what types of facilities does a policy apply to, what might not always be the clearest. And if you have different documents, sometimes they might have discrepancies, and how do you deal with those conflicting sources of information? Possible solutions involve reliance on secondary sources to try and kind of bridge some of the gaps we might find as we're dealing with sometimes inconsistent state websites. Starting off with a smaller scope, say, batches of only 5 states to kind of really dig into the policies, make sure we're not missing anything, and maintaining a clear research protocol throughout the entire thing. The clearer we are in laying out our protocol, the easier it is to make changes and make sure that we're not, from one state, we're looking at it from this way, from another state, we're looking at them this way. Trying to make things as consistent, scientifically rigorous as possible. So next up, we just want to take a step back and look at some of the takeaways we have from our experience with these data sets, for which I'll turn it back to Alex.
Thanks. Yeah, so we really wanted to kind of keep in mind what, despite the policy, things are looking like on the ground, so to speak. So we know that calls for decarceration quite generally have not been met across any state, really. As you can see on the right-hand side, this prison policy initiative map, which evaluated state efforts to prevent COVID-19 deaths behind bars. They graded every state, and it should come as no surprise that no state got above a D- in their efforts And we know that although prison populations have fallen in some places at some points in time, this is largely not as a result of facility releases, but rather as a result of a reduction on intakes overall. So it's important to keep in mind why and how populations are being reduced. And this is really important in understanding the fact that COVID-19 cases and deaths in prisons have skyrocketed at alarming rates. It's estimated that 1 in 5 prisoners has had a positive COVID-19 test compared to 1 in 20 generally across the nation. And despite prisons being hotspots, we know that they're failing to provide adequate care, and whether that means providing face masks and thinking about how this will apply to vaccinations moving forward. We know that courts have already stepped in, so it'll be important to keep an eye on how this shapes policy moving forward. Next slide. So again, it's important to kind of step back and think about how this really matters in terms of looking at health outcomes generally. So we know that legal epidemiology methods can help to bridge the gap between policy and health outcomes. And this research can really expand upon the existing public health evidence for policy measures like decarceration. But we know that the evidence alone is not enough. Despite it existing, the policy on paper is really a lot different from the policy, from the on the ground implementation. So states might have policies that provide for inmate release, but whether or not this is actually happening fast enough, and if this is happening for all the eligible populations, is a whole other question that needs to be taken into consideration when thinking about this kind of research. So on that note, thank you so much